Well, good morning and welcome to Webinar Wednesdays with SMP. We're really glad to have you all here with us this morning. My name is Sunny Lawless and I'm the volunteer coordinator for our SMP programs. I'm going to be your host for this morning. And then presenting for us today is going to be Shay Lewis and Jose Pinto. They're both community outreach specialists for our Georgia SMP. Today, for our November installment of Webinar Wednesdays, we are going to be talking about scams that are affecting and targeting older adults. During the presentation, you're welcome to type in any questions that you might have into the chat, and we'll hold those until the end of the presentation when we open things up for Q&A. There will also be a prize drawing at the end of the presentation, and you must have been registered to attend the webinar prior to 10:15 this morning. And you also have to be present to win. Before we get started, we do have to let you know that this project is supported by the Administration for Community Living, Department of Health and Human Services as part of a financial assistance award with 100% of our funding by ACL and HHS. The contents are those of the authors and do not necessarily represent the official views of, nor are they an endorsement by ACL, HHS, or the US government. And if you're joining us for the first time today, we want to give you some information about our program. So who is Senior Medicare Patrol? Well, SMPs are grant-funded projects, like we said, from the Department of Health and Human Services and the Administration for Community Living. All SMP grantees have a shared national identity through a national program name and logo. Every state has its own SMP program. In Georgia, Louisiana, Mississippi, and Vermont, SMP is sponsored by AdviseWell. And the mission of SMP is to empower and assist Medicare beneficiaries, their families and caregivers to prevent, detect, and report healthcare fraud, errors, and abuse. And we do that through outreach, counseling, and education, like we're doing today. So I'm going to go ahead and turn things over to Shay, who is going to get us started on what is a scam.
All right, good morning. All right, so a scam is defined as a dishonest or fraudulent scheme that attempts to take money or something of value from people. Next slide. There are various types of scams that seniors need to be aware of, which can include the following: government impersonation scams, Medicare impersonator scams, identity theft. In the next slide, we'll be breaking down some of the common scams that target seniors, and the first one is government impersonator scams. Next slide. Scammers pretend to call you from government agencies, including Social Security Administration, Medicare, and the IRS. Government impersonator scams often email or text message from someone who says they're with the government agency, providing their employee ID number to sound official. They'll give you some reason why you need to provide your personal information immediately. So if you do experience a call like this, hang up the phone. It is definitely a scammer. Please remember, government agencies won't call, email, or text you and ask you for money or personal information. I'm going to repeat this tip one more time. Please remember, government agencies won't call, email, or text you and ask you for money or personal information. If you don't remember anything else from this presentation, please remember this important tip. We're going to discuss some important tips to remember in avoiding government impersonation scams. Next slide. So some quick tips to avoid government impersonation scams include not wiring money, sending cash, or using gift cards or cryptocurrency to pay someone who says they're with the government. Scammers will ask you to send money using these specific payment methods since it's hard to track the money and it's almost impossible to get it back. They'll take your money and disappear. Don't give out your financial or other personal information. Don't give your personal or financial information to someone who calls, texts, or emails and say they're with the government. If you believe a call or message could be real, Take these important steps. Stop, hang up the phone, and call the government agency directly at their number that you know is correct, which normally is on their government website. If you don't know if a website is considered a governmental website, always look for .gov at the end of the website. Don't trust your caller ID, and also don't click on links in unexpected emails or text messages. Scammers send emails and text messages that look like they're from a government agency, but are really designed to steal your money and personal information. Please don't click on any links or pass it on to others. Simply delete the message. Next slide. If you become a victim of this scam, please go to the Federal Trade Commission, which is the FTC's website, to report the fraud. They'll guide you to the page, and you'll have the opportunity to tell what happened by reporting the scam, company, or unwanted call. Next slide. If you receive a call, email, or text message asking for your Medicare number to get a new Medicare card, or offers medical equipment, or even access for your bank information in order to send you a new Medicare card, this is considered a scam call. And if you're in need of a new card, Medicare will send it to you for free without you having to do or pay for anything. In the next slide, we'll discuss how to prevent Medicare impersonator scams. Scammers can sound very professional, stating that they're from Medicare and have your personal information. However, they're really just trying to steal your money, Medicare information, or your identity. Next slide. Here are some tips to prevent Medicare impersonator scams. If you get an unexpected phone call, email, text message, or even a DM, a direct message on social media from someone claiming to be affiliated with Medicare or Center for Medicare and Medicaid Services, CMS, do not answer the phone. Chances are they are a scammer. Don't call them back at the number they give you, and don't use the number that showed up on the caller ID. If it's a robocall, don't press any numbers. If you get an email or text message, don't click on any of the links because the link could be designed to steal your personal and financial information. Call 1-800-Medicare for questions about your benefits, your card, your Medicare number, or to even report suspicious activity. If you observe your MSN or EOB statements and notice anything suspicious on your statement, there are several tips that you can take with that situation. You can call your doctor's office because the medical office representative could have made a human error in the system with various healthcare codes and accidentally typed in the wrong one in the system. If nothing has changed, please call our toll-free hotline number at 877-272-8720 to speak with a live representative regarding the situation. Also, you can get help to deal with Medicare fraud and abuse at smpresource.org. And if you have given out your personal information to a scammer, you can also go to identitytheft.gov for steps to take to protect yourself. Next slide. Identity theft is defined as the fraudulent acquisition and use of a person's private information, usually. The identity thieves could steal your information in various ways, and that could be including applying for credit, filing taxes, or receiving medical services. With these particular acts, they can damage your credit status and cost you time and money to restore your name in good faith. Next slide. Scammers and thieves are getting clever as time progresses. So here are some preventative measures to keep in mind when it comes to identity theft. Securing your social security number. Don't share your personal information. Of course, that's including your birthday, social security number, bank account number, because if anyone asks for it, review your credit card and your bank account statements and your medical statements as well. You'll be surprised at what you can identify on your quarterly medical statements. Store your personal information in a safe at home if you have one. Shred receipts, credit card offers, account statements, and expired credit cards. There are many dumpster diver thieves that are always looking for your information through large trash bins. Next slide. Next up, it's that time of year, and it's a good time for us to learn more about the different types of scams that typically occur during the holidays. Next slide. Holidays are the time of year where you're enjoying your loved ones and celebrating in holiday cheer. Every year, thousands of people become victims of holiday scams. Scammers can rob you of your hard-earned money, personal information, and at least a festive mood. The two most prevalent holiday scams are non-delivery and non-payment scams. In a non-delivery scam, a buyer pays for goods or services they found online, but those items are never received. Conversely, a non-payment scam involves goods or services being shipped, but the sellers never paid. Your Medicare number can also be used in a non-delivery scam. If your Medicare number falls into the wrong hands, Medicare could be billed and pay for items or services that you never received. Next slide. According to the Internet Crime Complaint Center 2022 report, non-payment or non-delivery scams cost people more than $281 million. That is a lot of money. Credit card fraud accounted for another $264 million in losses. That is a lot of money to lose during the holidays, especially when purchasing these gifts in advance. The Internet Crime Complaint Center receives a large volume of complaints in the early months of each year, suggesting a correlation with the previous holiday season's shopping scams. Next slide. Whether you're the buyer or the seller, there are various ways to protect yourself and your wallet for this holiday season. Some of these tips could include practicing good cybersecurity hygiene. Some include don't click on any suspicious links or attachments in emails, on websites or social media. Phishing scams and similar crimes can get you to click on links and give your personal information. Again, this refers back to your name, your password, and your bank account information. Be wary if a company asks you to update your password or your account information. Look up the company's phone number on your own and call the company. Another tip is know who you're buying from or selling to. Check each website's URL to make sure it's legitimated and also secure. A site you're buying from should have HTTPS in the web address. If it doesn't, don't enter your information on that site. If you're purchasing from a company for the first time, do your research and check the reviews. Reviews are always helpful and provides a realistic view of the company's product, the customer service, and the shipping process. Verify the legitimacy of a buyer or seller before moving forward with the purchase. If you're using an online marketplace or auction website, check their feedback ratings. Be wary of buyers and sellers with mostly unfavorable feedback ratings or no ratings at all. This is a telltale. Avoid sellers who act as authorized dealers or factory representatives of popular items in countries where there could be no such big deals. And this could include your luxury designer bags, jewelry, and etc. This is normally popular on social media platforms, including Facebook Marketplace and also Instagram. Be wary of sellers who post an auction or advertisement as if they reside in the US and then respond to questions by stating they're out of the country on business or either a family emergency or similar reasons. Another tip is be careful of how you pay. Never wire money directly to a seller. Avoid paying for items with prepaid gift cards. In these particular scams, a seller will ask you to send them a gift card number and a PIN. Instead of using that gift card for your payment, the scammer will steal the funds and you'll never receive your items. Use a credit card when shopping online and check your statement regularly. If you see a suspicious transaction, contact your credit card or your bank account to dispute the charges. Another tip is monitor the shipping process. Always get tracking numbers for items you buy online so you can make sure that they've been shipped and you can follow the delivery process. Be suspicious of any credit card purchases where the address of the cardholder does not match the shipping address where they're selling. Always receive the card holder's authorization before shipping any products. And remember, if it's too good to be true, it probably is. Please be safe this holiday season shopping for your loved one.
Afternoon, everyone. My name is Jose Pinto. I am with the Georgia Senior Medicare Patrol as an outreach specialist, and I'm here to talk to you about our basic 3 keys to success in preventing fraud, errors, and abuse. Prevent, detect, report. Next, please. One of the biggest steps to prevent Medicare fraud is share your Medicare number only when necessary, such as at the doctor's office or pharmacy. Only carry your Medicare card with you when you know you will need to use it. And remember, Medicare will not call you to ask for your Medicare number for any reason. And as Shay did in our previous part of this presentation, I want to repeat that again. Medicare will not call you to ask for your Medicare number for any reason. We've been getting a lot of reports as we've been doing presentations that seniors and caregivers in the community are getting calls that are stating that they are from Medicare, asking for people's to verify people's Medicare numbers. So be really careful. People are out there doing that right now. Also, keep records of all medical visits and procedures that take place and medical equipment ordered. Next, please. The best way to detect Medicare fraud is, of course, to review your Medicare summary notices or explanation of benefits for inaccurate information. Remember, some of you will get a quarterly Medicare summary notice. Other people will get a monthly notice if you have an Advantage plan, just like when you were working and receiving your work provided or employment provided health insurance. So make sure you review these and you're getting only the services that you received, that you're being billed for only the services you received. Medical appointments you did not attend or were double billed for, keep an eye out for that. Also, medical equipment like braces, catheters, or diabetic supplies you did not order or receive. And please, if you have a caregiver with you or someone that comes with you, like your daughter or son or grandson or granddaughter, niece, nephew, please have them help you keep track of what services you have received from your Medicare medical provider. Next, please. And of course, always report suspected fraud, errors, and abuse. If you receive a suspicious call, hang up immediately. Call your provider or plan if you have questions about charges from an appointment. Call us at the SMP hotline if you suspect fraud against your Medicare or with concerns. And please call, talk to one of our operators, make sure that you interact with them. Don't just ignore something that's in your gut that doesn't feel right. Give our number 877-272-8720. That's 877-272-8720. Give that a call if something doesn't feel right about one of the charges on your explanation of benefits, or if you got into some kind of conversation with somebody that called you on the phone and you thought maybe you gave away some information that you shouldn't have. All right. Next, please. And also volunteer to help protect Medicare and seniors. We have a wonderful volunteer coordinator, Sunny. She's on the line right now. And if you want to be a volunteer, we have some wonderful volunteers all through the states that we work with. The ones here in Georgia are wonderful. Lynn, Mike, and Mark have just been wonderful for our program and have really helped us a lot. You can receive training on the basics of Medicare and Medicare scams to provide short scripted presentations and attend community events in your area to educate seniors on fraud. You can also, when you're volunteering with us, it's flexible and helps protect older adults. And you can participate in bi-monthly webinars and trainings throughout the year. If you're interested, please, once again, call that same number at 877-272-8720. If you're interested or have any questions, talk with Sunny. It's really a wonderful thing you can do for your community. And our volunteers that I've worked with here in Georgia have really seemed to enjoy what they do. Next, please. You can go ahead and follow us on Facebook and other social media platforms. Please scan the QR code below. Review our postings to stay updated on the latest scams and events we will be attending or hosting throughout your state. Keep informed by watching our educational YouTube videos and podcasts about fraud impacting older adults. And guys, I advise you all to at least go and sign up for our webpage or our Facebook page and just follow it. And I think you'll really enjoy some of the information that comes out of there. Next. Together we can fight Medicare fraud. We're empowering seniors to prevent healthcare fraud. Call us to report potential healthcare fraud and discuss related concerns or request us to attend your event, 877-272-8720. Visit our website at www.stopmedicarefraud.org for more information about the SMP program in your state. Also, follow us on Facebook at the Georgia, Louisiana, Vermont, or Mississippi Facebook page. I think you'll really get a lot of good local information. Next.
All right, thank you, Jose and Shay, for that information. So coming up next month for Webinar Wednesdays, we are going to be talking about Medicare card scams. So protecting my Medicare. And that presentation is scheduled for Wednesday, December 18th at 10:30 Central, 11:30 Eastern. So just be on the lookout for your invitation to register for that webinar soon. Okay, now it's time for our prize drawing. So everyone who was registered to attend today before 10:15 a.m., your names have been entered onto the prize wheel to win a $25 Amazon e-gift card. So if you'll give me one moment, let me pull up the wheel and we'll go ahead and give it a spin and see who our winner is for this month. And you do have to be present to win. So let me check our list here. I don't see them here, so I'll remove their name and we'll give it another spin. Let's see, Linda Haynes. I don't see her here. We'll just spin until we have a winner. Okay, it doesn't appear that Miss Melita is here. Miss Stephanie Gray. Congratulations, Miss Stephanie. You're the winner of our $25 Amazon e-gift card today. So just be on, I'll send you an email to get your information to make sure we get you that card. And let me write Stephanie Gray as our winner. All right, so congratulations. Let's see. All right, so before we wrap up our presentations for today, does anyone have any questions they'd like to ask? I don't see any that have come through in the chat, but you're more than welcome to raise your hand if you like, and we'll unmute your line and you can ask us a question. As you can see on the instructions here, you can find your hand button. Let's see, Miss Stephanie, I've unmuted your line. You just have to unmute your phone so you can ask your question.
Hi, everyone. I don't have a question. I just wanted to say thank you.
Oh, okay. Well, good. Thank you. We appreciate you joining us this morning.
You have a good one.
You too. All right, well, I don't see any other hands raised. So this is going to conclude our presentation today on scams. You will receive an email after the webinar today with a link to a short survey. We would really appreciate it if you would just take a few moments to let ACL know how we did with today's presentation. We appreciate you all joining us, and we hope to see you again next month for our last webinar Wednesdays of 2024. And I hope you have a good rest of your day and rest of your week. Happy holidays, happy Thanksgiving next week, and we will see you again soon. Thank you so much for joining.